All right, so squatting with knee pain. If you have some patellofemoral pain or pain under your kneecap, it's common that you have issues with squatting, sometimes grinding or crepitus in there we call it. You can still squat most of the time, but you gotta try and learn to do it in a way that'll keep it as pain-free as possible and try and take some pressure off that patellofemoral joint. So when we squat and you've got some patellofemoral problems, what we wanna be careful of is how far your knee is going forward. Right? It's physics. The further that knee kicks forward, the more pressure is going to be back in that joint on that kneecap. Generally, the more pain, the more grinding you're going to have. So what I'm going to try and do is get some pressure off that kneecap and use my hip girdle more to do the movement. So when I'm doing these, I'm going to go feet about shoulder width apart. I'm going to stick my butt back, bring my chest down. I'm going to hinge at my hip like I was going to sit in the chair. I'll bring my arms forward to help with my center of mass. So I'm coming down, out, right? Straight from the side. Butt goes back. Most of my weight stays on my heels. Okay? This is the way we want to do it versus this. If you do this and you've got patellofemoral pain, I can about guarantee it's going to irritate it. It's going to get more sore. If you can learn to use your hip more, keep the pressure off that joint, generally it's going to feel much better, and then you can progressively work on doing more and more of these and increasing your tolerance. It's all about trying to take the force off that patellofemoral joint, transfer it more onto the muscle to take the load.